Alright, setting up for surgery. The first thing you do is start your laptop, and when you start your laptop you want to log in under the surgery tab, not any other tab, not admin, not LAC or whatever else is an option. So surgery only. The next thing I usually do is turn on my oxygen tank. When you turn on your oxygen tank, you want to check your pressure setting right here and make sure that the dial is set to the little red arrow. And if it's not, you can turn this left or right, up or down, until your needle reads right around where the red arrow is. This is your tank level. So when it's full, it's usually somewhere over here. And as you go through, it will begin to be empty. If it empties, then your pressure dial is going to start to go down. If you see your pressure dial going down, you want to switch your tank and call Airgas to have a replacement tank sent. This is your nitrogen tank, and it's the same sort of deal. When you turn your tank on, your tank level is right here, and your pressure setting is right here. You want to make sure your pressure setting is set to the little red arrow, and this is your adjustment valve, left or right. The next thing you want to do to set up would be to print your appointment schedule for your surgeries. We print our schedule, we put it in the window, we highlight our surgeries so we know what we're doing. Print out our patient labels and make an Excel anesthetic record for each patient. I usually will bring one up and save it under the patient name till I have one for everybody, and then I can start entering information. Next thing would probably be a leak check of the anesthetic machine. You connect your large hose, 2-liter bag. Your oxygen would already be on. Close your pop-off valve all the way. Occlude your breathing tube with your hand or your thumb. Use the oxygen flush valve to fill your bag up until it's almost full. And then use your oxygen flow dial. Turn up your oxygen flow until your bag starts filling, until it reaches 20 centimeters of water, just above 20 centimeters of water, and it has to hold for 5 or 6 seconds at that pressure before you know your pressure system check is done. When you are done with your check, you want to open up your pop-off valve to release the air. Then you can let go of your breathing tube and your leak check is done. When you do that, you want to check your anesthetic level in that window down there. And I'll normally just make sure it's full for the day. It goes into this little reservoir. Screw it off, screw it on. For the anesthetic machine, you would probably also want to check to make sure that your soda lime and your clean air canister don't need to be changed. For that, you look at the date on the bottom of the canister down there. It needs to be less than 4 weeks out, so change it every 2, 3, or 4 weeks as needed. I will go and get a set of large towels for my table. Hand towels with extra towels. I will then get my IV sets ready, flush the lines, connect it to the IV pump, the IV fluid warmer. Make sure there's no air in there. Make sure your little crimper is open. Make sure the roller wheel is open. I will cut pieces of elasticon tape for each size patient. Then I will set up my anesthetic monitoring lines. You have your heart monitor line. You have your pulse ox line. You have your, this is the capnograph tube, and this is your little cheaper. The cheaper we keep in one of the drawers. Appropriately sized endotracheal tubes. Esophageal stethoscope. A mouth gag with either gauze or paper towel. Your little inflation syringe for your inflation cuffs on your endotracheal tubes, your IV line for your patient, Then out of the drawers over there, we will pull out our cup of needles, our surgical glue with a fresh cap on the top of it, antecedent for our feline patients to wake up, and lidocaine gel for the gag reflex on our cat patients. Then we will pick out an appropriately sized surgical drape and pack for whatever we're starting with. If it is a spay of some sort, we get a V-tray, small, medium, or large. Then you have your water blanket, and make sure that when you start your water blanket that the water level in that window is at the top line. If it's not, just fill the reservoir up at the top with some distilled water. Then you get your surgery prep fluids ready. You've got alcohol, your blue surgical prep solution, distilled water for cleaning, dry gauze, and some soapy wet gauze. Oil your clipper blades, make sure they're clean. And if you're setting up for dentistry, then you check all your dental stuff, your water levels, oil your drill, prophy cup, pressurize your bottle, put your foot pedals down. Make sure your dental tray is ready, and then get Neil's surgical gloves out of the top shelf. Put them in the window, and double check your checklist of surgery setup.